Magandang araw sa inyong lahat. Good day to all. I am Dr. Carmencita Padilla, one of the proponents of the newborn screening program in the Philippines. Join me in uncovering the wonderful story of newborn screening in our country. Together, let's zoom in on what makes newborn screening a comprehensive program for every Filipino here at Newborn Screening in Focus. In the first season, we had an extensive discussion about the birth of newborn screening program in the Philippines, the collection and management of samples, the factors that might affect newborn screening results, how the NSCs coped with the challenges brought about by the pandemic, and in detail discussed the featured congenital disorders. In this second season, let us join again as we dive deep into the systems of the Philippine newborn screening, study the partner organizations and their role in making newborn screening an outstanding program, and, in detail, discuss some congenital disorders from our expanded newborn screening panel of disorders. This video series serves as an educational platform for our newborn screening coordinators, one in every 7,200 health facilities throughout the country. But just like all accomplished programs, the success of this video series relies on the consolidated effort of many sectors: the newborn screening centers, the satellite and continuity clinics, our partner organizations, such as the Centers for Human Genetics Services, the DOH, PhilHealth, and many more. We hope that with your continued support, we'll be able to achieve our ultimate mission of setting a world-class newborn screening program in the country. So, without further ado, take a seat, get comfortable, as you're in for quite an adventure here at Newborn Screening in Focus.
Kaya dapat magpa-newborn screening.
Water on my problems seem to float away. I'ma keep it real. I just wanna chill. I don't worry about a thing. I just do it for the thrill. Grass is always greener when you're sitting on a hill. And the glass is never empty cause I keep it real. I got big dreams that all about to come true. Chilling at the top with a nice view. It's a good life right now. It's a good life right now. Said I got big dreams that all about to come true. Chilling at the top with a nice view. It's a good life right now. It's a good life right now. Good life, it's a good life. Good life, it's a good life right now. Good life, it's a good life. Good life right now. Good life, it's a good life.
Welcome to the 17th episode of Newborn Screening in Focus Season 2, where we will talk about the role of NGOs and medical societies in the newborn screening program. Achieving an effective newborn screening program requires different sectors of society to be actively involved. This includes the non-government and medical organizations and societies, which provide a mix of services in the delivery of quality newborn screening and the development of the program. Today, let's hear about this beautiful partnership with the representatives of their respective organizations. In this episode, we have Dr. Cynthia Feliciano, President of the Philippine Society of Pediatric Metabolism and Endocrinology, and Dr. Rizalina Gonzalez, President of the Newborn Screening Society of the Philippines Incorporated. Dr. Cynthia and Dr. Riz, welcome to Newborn Screening in Focus.
Good afternoon.
Hello po, Dr. Good afternoon.
Thank you for joining us today. And let's start the conversation. So, Dr. Reese, tell us something about your organization.
Hi, magandang hapon po sa lahat. I'm Dr. Riz Gonzalez, the current president of the Newborn Screening Society of the Philippines. This is actually a non-stock, non-profit organization founded in October 2001 by very enthusiastic department chairs of the different hospitals in National Capital Region to start this newborn screening project. It's just a newborn screening project then. But through the years, it has developed into something big and great as what we are experiencing now. The Newborn Screening Society of the Philippines is mainly aiming to educate the awareness and to give you the basics and advances of our newborn screening program every year by organizing the Newborn Screening Annual Convention every October.
Thank you, Dr. Reese. Let's now hear from Dr. Cynthia. Dr. Cynthia, just tell us about your organization.
Our organization, the Philippine Society of Pediatric Metabolism and Endocrinology, or PSPME, is a small society of board-certified pediatric endocrinologists. Now, when I say small, we are just 31 members in the society as of June of this year, with an addition of 4 new board passers last May 2023. So these 31 pediatric endocrinologists are distributed in the different regions of the country. And we have one in Mindanao, one in Tacloban, one in Iloilo, 2 in Cebu. We have 5 in Southern Tagalog region. And sa South naman po, we have one in Baguio, one in Pangasinan, one in Ilocos, one in Pampanga, and the rest of us, mostly our seniors, are concentrated. They are practicing in the National Capital Region.
Dr. Cynthia, konti lang kayo, no? 31. Now, how is it connected with the newborn screening program? So can you tell our audience which of the disorders are connected with your field of specialty?
The 2 of the disorders in the newborn screening, which are the congenital hypothyroidism and congenital adrenal hyperplasia, are the 2 endocrine disorders which are being monitored by our society or by our specialists. Now, before ma'am, diba, we have a few of the geneticists. So yung ibang metabolic disorders are also being handled by our members, specifically Dr. Babu Estrada being a metabolic specialist also. But right now, mas concentrated na po more on the CH and CAH.
So in other words, Dr. Cynthia, which component of the program are you involved with? Maybe we can share that with the midwives and the nurses and the other physicians. Which component of the program?
So to start with, dun sa short follow-up po, yung closing ng cases. So once we have a positive screen for CH and CAH, as much as possible, they're being brought up to us for confirmatory testing and closure, whether they are truly positive or otherwise, kung hindi naman talaga. And succeedingly, we have a memorandum of agreement with the DOH and the NSRC for the long-term follow-up, wherein we go to the different regions to take a look of this CH and CAH positive patients, wherein we don't have the specialist in the region. So twice a year in that particular area, we go there to check on these cases, whether they are being properly treated and monitored. And aside from the direct contact with the patients, specifically the charity patients we have there, we are also involved in the, for example, putting up the algorithm for the CH and CAH. That's another one. And just recently, we have the experts committee on CH and CAH, wherein we meet regularly, specifically on a monthly basis, to check on the data sets and review whether our cutoff still fits in to what the trend is being shown to us by the newborn screening.
Okay. Thank you, Dr. Cynthia. Napakadami no, no? Well, the first point is, and this is a review for our coordinators, she mentioned the closing of the cases. So remember, newborn screening is just a screen, and we have experts guiding us on how to close the cases. And as she said, once the patient has been diagnosed, there is an endocrinologist who's assigned to the patient so that we make sure that the treatment is correct and that the patients and the parents do not skip the treatment for the patient throughout life. So, and one more point that Dr. Cynthia mentioned is that throughout the year, because there are very few endocrinologists, they actually go around the country to follow up the patients. So in other words, the program is not limited to the pediatricians who are doing the screening, but it includes the specialists. So I'm going to ask Dr. Reese right now, how do we connect the conversation with the endocrinologist? Because I remember the programs that you have prepared. Tell us on how your society now is connected to what Dr. Cynthia was sharing.
Thank you, Dr. Sinch. That was actually very enlightening. And among our panel of experts, we are closely working. It's you, the endocrinologist, because if you're going to remember, that very impactful poster is actually the poster of two people, one with treated congenital hypothyroidism and the other one is untreated. So that really created a wave of awareness. So during our annual convention, most often, we still do give updates and the basics of diagnosing congenital hypothyroidism because it really makes a life better for these children, whether they are screened, they are followed up until there is such a thing as closure. So that is the beauty of having annual convention. We don't stop with one topic alone for 1 year, but we do continuing education on how are we doing with the program, this newborn screening program in the country.
Okay. Thank you, Dr. Reese, no, again, for our audience. It's so important to emphasize continuing education because the convention actually comes up with discussion of cases. I mean, that's one. And they're able to come up with the different forms of management that's needed for the patient. So, whereas our endocrinologists are going down to the field, here you are, Dr. Reese, together with the organization, the NSSPI, coming up with the convention so they can actually reach much further. Now, in terms of the partnership that we have, what have been your challenges, Dr. Cynthia?
The biggest challenge so far, Doctora, is more of yung scarcity ng specialists on our part as a society. Considering the 31 lang kami throughout the country, there are still a lot of regions, places that we don't have ped endos. So in that particular case, we do not want to have delays, diba, in the diagnosis because the treatment, the management, the prompt treatment is very important. So right now, with that challenge, we are trying to, let's say, increase the number of our trainees so we can have more graduates and saturate the other areas that we don't have these specialists.
Ang laki pala ng shortage natin talaga, no, Dr. Cynthia. There's a call if there's a doctor or even students right now who are looking for a possible specialty, may shortage tayo sa Pilipinas. At bakit ba napakahalaga, Dr. Cynthia, na makita sila kagad ng endocrinologist? What is that complication that we are avoiding?
Ma'am, specifically for congenital hypothyroidism, what we are after is the prevention of the mental retardation. Kasi if we are about to recognize and diagnose and treat the patients promptly, so walang mental retardation. So sayang naman ano po kung mamimiss out pa natin yon. So in that particular case, with the scarcity of our ped endos, we would like to empower also our general pediatricians that they should be able to know how to treat these patients correctly and how to monitor them.
When is the best time to treat them, Dr. Cynthia?
As soon as possible, ma'am, as soon as they are diagnosed right away. Because every day, one or two IQ points can be deleted, for example. Sayang naman.
Okay, so para naman sa ating mga coordinator, no, napakahalaga ng kaagad ma-confirm ang pasyente. Dahil sabi nga ni Dr. Cynthia, kailangan simulan kagad ang gamutan. A day of delay means a loss of at least 1 or 2 IQ points. Dr. Reese, you were mentioning the poster earlier.
Yes po. That's actually very, very vital information, a visual information which the parents themselves and the healthcare practitioners can explain clearly the value of the timing and the treatment of disorders that we are screening. It's the congenital hypothyroidism which we are actually very successful. And that poster has created a very, very, very good the program, the beauty and the success of this newborn screening program. Now, for our part, the Newborn Screening Society of the Philippines, we always start with the basic for the pre-convention because many of the young are joining as the the newborn screening facilitators. So we don't want to forget the technique, the proper timing, and then the advances for the plenary sessions so that the continuous learning to improve on saving children not only from mental retardation, but also other problems that they will be encountering as they grow up.
Okay, so talagang importante talaga, no? Nandun pa rin ang education. Now, earlier I asked Dr. Cynthia about challenges of the organization. What about your organization, ang NSSPI? Ano ang challenges niyo?
The greatest challenge we faced was during the pandemic. You know that we are getting the samples every day, and the pandemic really challenged us how to gather this information dissemination. We were not all connected via the internet. The platform then for convention was in person. But however, thanks to technology, no matter how crude it is, thanks for the smartphones, we were able to get a platform for, that is the Zoom in October 2020. Miraculously, during in-person, we only have 1,000, 2,000 participants. Well, it doubled up to 3,000 participants in October 2020. And we're so happy that it even doubled in 2021 and 2022. You see the importance, the interest of these people with us, the midwives, the nurses, the medtechs, the chemists, and the nutritionists. So we're not doing it alone as doctors. We are all in one family for the successful program, this newborn screening program, which is a very important public health activity that we should always be continuing until we reach our goal.
Okay, maraming salamat ng Dr. Reese. Now, medyo gipit tayo sa oras, but I want to go back to Dr. Cynthia because we talked about, you mentioned the complication of CAH, hypothyroidism. What are the complications of congenital adrenal hyperplasia? Nabanggit po siya kasi kanina. Pakibanggit lang yung complications ng CAH naman.
Sa complications naman po ng CAH, of course, if they are the classic type po, yung salt wasting, magkakaroon sila ng dehydration, metabolic electrolyte imbalance, and eventually they can go into adrenal crisis, and that can succumb to death of the patient. So, importante din po, especially for these classic cases, na ma-diagnose early and to be treated promptly.
Thank you, Dr. Cynthia. No, I just want to remind the audience that in the first season, we had 2 topics on congenital adrenal hyperplasia. In those 2 episodes, we talked about the condition in detail. But this time, we're talking about the role of the organization. Now, I'd like to ask both of you on the what are your plans for your organization in terms of expanding for the program? I'll start with Dr. Reese.
The challenge now is we're emerging from the pandemic. We're going back again to the face-to-face convention. We're going to start again from the basic 500, or we might end up 750, because nothing beats in person. There's the visual stimulus, the hearing, and the camaraderie. And that makes education and learning and connectivity to each other so that we will not be tired in helping the newborn screening program and the dedication and passion in doing this public health program.
Thank you, Dr. Reese. So we're going back to face, and we know we have very limited audience with face-to-face. Meron bang balak ang NSSPI for regional conventions in the future?
Yes, ma'am, because we're expanding and the 3,000 delegate is actually impossible to handle. So we will go region by region, and just like what we're doing now, we have the TVUP, wherein the basics and the most important disorders that's being screened is being highlighted. So that's good. And even mom workshops and this platform is actually a challenge to use for next year's hybrid convention, hopefully.
Okay, nangako dyan si Dr. Reese. What about for Dr. Cynthia? Dr. Cynthia, what are your plans for the organization? Expanding your contributions and role in the program.
Okay. Ma'am, for the future plans, well, PSPME, for now, we are involved sa experts committee ng CH and CAH. So one is research. We would like to make several quote-unquote research sana, so that based from this data that we can gather here, we can improve the program more, perhaps policies and in how to go about with the challenges we have in the program. And the other one is registry also. Kasi so we can have this established registry and number of cases talaga for all, para pag magpe-present din tayo, meron talaga tayong data of our own, hindi lang yung data ng ibang countries. And of course, for the part naman sa patients, continued collaboration with NSRC specifically for the long-term the continuity clinic, because during those times that we are also reaching out to the parents, the families, and meron kaming mga lay forum to remind them that they should not stop, because the treatment is lifetime, and sometimes they are not, perhaps nawawala sila minsan sa nila na because of opinions of others. They should be refreshed every now and then that this has to be a lifetime treatment and monitoring for children.
Thank you, Dr. Cynthia. And I hear more researches and a registry as commitment of your society for the improvement of the program. Alam niyo, napakaikli talaga ng oras, no? We will never run out of things to share with our coordinator. So maybe in our last few minutes, can I request first, maybe Dr. Cynthia, what's your message to our audience? And our audience are the midwives, nurses, and physicians who are newborn screening coordinators of our program. Last message.
So our society is a part of the newborn screening program, and it is not only us, but kayo pong lahat, yung nabanggit po ni Doktora kanina, we are all part in this newborn screening program. So kailangan po nating in constant collaboration among ourselves to make this the future of these children better and brighter. Now, wala sana maging complications because of the efficient and effective execution of this particular program. Collaboration po tayo lahat. Let's support each other.
Maraming salamat. What about you, Dr. Reese?
The challenge is always to make these complicated topics intelligible and understandable to the lay, because we have not only doctors attending the convention, we have midwives, nurses, to translate this technical knowledge advancements for dissemination to every healthcare practitioner involved in the newborn screening project. Because we can never be successful if we don't understand what we're doing. And we can never be successful if we don't have the passion of educating ourselves continuously, because it is the lives of these babies that we are screened that matters. We will continue to save lives, not just for mental retardation, but for a healthy life of all the children born here in the country.
Wow, thank you very much, Dr. Reese and Dr. Cynthia. And those are really words that will bring home the message to our coordinators. As I said, there are 7,000 potential watchers of this show, And I hope that, they will remember the messages that you have imparted to them. So maraming salamat sa yung dalawa, Dr. Cynthia and Dr. Reese. And we definitely will invite you again in another episode of Newborn Screening in Focus. Maraming salamat sa inyo.
Thank you,
Thank
ma'am.
you po.
Thank you.
Public health programs should make use of all domestic resources as part of their efforts to make healthcare services accessible for all. This episode has demonstrated how an NGO and different medical organizations are a crucial resource for the delivery and development of the newborn screening program in our country. Through this dialogue, we also learned about the ways we can further improve our engagements to our partners and stakeholders for the ultimate goal of delivering accessible and quality newborn screening service. To our virtual audience, please send us your comments, questions, or the list of topics that you want us to cover in our succeeding episodes. Email us at info@newbornscreening.ph or you may tweet us at newbornscreenph and also include the hashtag #ENBSPH. We continue to improve our services as deemed necessary by the emerging challenges through an open dialogue about our experiences in newborn screening. It is our hope that through this video series, we extend the sharing of knowledge with greater reach, empower our frontliners, improve connectivity with the newborn screening coordinators, and most importantly, provide unparalleled service to every family. We can't wait to see you again the following week as we go into more detail on the long-term effects of galactosemia and the risk for other family members or future babies. This and more in Newborn Screening in Focus. Nothing is more precious than seeing a child grow healthy and normal. Let's realize this through newborn screening. Newborn screening is a gift of life.